You're most welcome. Early start for me. My turn to burn. The name is Naughty by Nature. The program is Ultimate Health, your ultimate guide to healthy living. This and every Sunday, we're alive by His grace and providence. Tell a friend to tell a friend. Put your seats in the upright position. These days, I will not say extinguish all cigarettes. Does that habit still exist? Some call it a program, I call it a promise. Some call it a frequency, I say it's a family. Impacts on your health and your well-being. I'll most definitely talk about it. Bring in all the top-notch practitioners and professionals. Let me take some praise. I love this one by Eternal, featuring BB Winans. I want to be the only one.
See you crying, and I feel your broken heart. I can feel your hurting. Still, you choose to play the part. If you let me be,
That's right. If you just love me, take the chance. I'll be worth the chance. Clearly see.
99.7 FM.
That's right, Eternal featuring BB Winans, Only One. Ultimate Health on Joy 99.7 FM. Yeah, today I've caught a big fish. I've had him a couple of times on Zoom.
You know he's another
Doctor Takyi. Yeah, we did the animals with him. And then Coco, consultant gastroenterologist and head of gastroenterology at the Kolebu Teaching Hospital, senior lecturer, University of Ghana Medical School. He's also a telemedicine consultant. This one is not Ibaumia. Please, we've been doing this for a while, yeah? Healing from a distance, telemedicine or telehealth. What exactly is it? Is it safe? What benefits does it confer? I know you like TikTok and other things, but hey, information technology has moved. So we're joined by Dr. Takyi. We'll be talking about telemedicine and how does it permit us or give us the opportunity to heal from a distance. If you have any questions, concerns, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. This is Ultimate Health on Joy 99.7. Dr. Takyi from Pando.
Thank you, Naughty.
What do I say? Wezo or? Wezolo. You're welcome. And
Akbar.
many thanks for making it into the studio. And we want to talk about telemedicine. Interestingly, I didn't share this with you when we were discussing or planning to do this, but years back, I dabbled in some of this. That must have been 2000 and something. Many efforts were being made to formalize and structure some of these things. I remember Vodafone wanted to do something, the Vodafone Health Line. They had a center in the then or former Ghana House, where they were now trying to build capacity, train the staff and the personnel to receive calls and do many other things. But it's good to have you to talk about this because, of course, with the COVID pandemic came more impetus, not that it wasn't there before, to realize this capacity and to harness it. And I'm glad to announce that Dr. Takyi is also one of the co-founders of All Round Virtual. Is it All Round?
All Round Specialist Virtual Clinic.
Right. All Round Specialist Virtual Clinic. Over 40 specialists harnessed and, should I say, put together in a tapestry, really, right? You can access all these people, professional specialists, at the click of a button. But we want to understand the concept and what safeguards you and I, and of course the benefits it yields and brings us. So, Dr. Takyi, let's just go through it. What do we mean when we say telemedicine?
Thank you once again, Note. So I think the flyer or the intro you have given actually aptly describes what telemedicine is, healing from a distance.
Right.
But allow me to put it in a few more words. So essentially what telemedicine is the provision of remote clinical services. Okay, in real time, via communication between a provider and a patient. Okay. So what that simply also means is that you get all the services you would get in a hospital, in your traditional brick and mortar hospital. But in this particular case, The difference is the doctor is in a different location and the patient is also in a different location.
Okay.
So you get to be evaluated. The doctor makes a diagnosis. You get a prescription. You can get your lab test done.
Right.
All whilst you're sitting at the place which is convenient to you.
Okay, right. Let just for the benefit of my listeners, also add the WHO definition, right? Which says the delivery of healthcare services where distance is a critical factor by all healthcare professionals using information and communication technologies for the exchange of valid information for diagnosis, treatment, and prevention of disease and injuries, research and evaluation, and for the continuing education of healthcare providers, all in the interests of advancing the health of individuals and their communities.
A wonderful description.
Right. So that is very broad.
Yes.
It means you guys, the qualified health professionals, care providers, can enhance your skills, can optimize your skills across domains, if I can use that.
Correct.
You can also arrive at clinical diagnosis, formulate your treatment plans, give prescriptions, in essence, treat people, right?
Correct.
And for many people listening to us, wow, this raises questions. Are we very soon going to be treated, diagnosed, managed by computers? Can you address that maybe skeptical point? It means that we're going to lose you at some point, or what is the interface, right? And how does this support and not supplant the conventional face-to-face consultation, physical laying of hands examination that we know?
Okay, great. So you've raised quite some points, and let me add.
Yeah.
So it's not surprising at all that people will be skeptical about using telemedicine. Of course, even now, some people do not do online shopping,
right,
or use mobile banking for similar reasons. But telemedicine offers several advantages, and it's not at all trying to take away the traditional hospitals.
Okay.
Now, what telemedicine entails basically is to bring some convenience.
Right.
So you sit in your house, you're feeling unwell, you just log on to your computer or your smartphone, identify a clinician,
right,
and say, okay, I want to see an obstetrician or a neurologist. And you make an appointment with this neurologist. And at appointed time, the neurologist appears on your screen. You have a discussion. He would ask you questions similar to what you would get asked in a hospital. In fact, there is some clinical examination, so many people are skeptical about telemedicine because they think there's no examination.
Okay.
Now, clinical examination entails several things.
Right.
One, every doctor knows that clinical examination begins with inspection or looking.
Right.
And so the right telemedicine really should be audiovisual. So you're seeing as well. So the doctor is able to see you and ask the questions.
Okay.
And during that interaction, he's able to assess your demeanor. If there are any changes to your body, the doctor can do that.
Right.
But also, you don't lose. The other aspect about the examination is that there are certain things like your blood pressure, your pulse, your respiratory rate, which many people are already checking at home, which you can still check and make available on the system and share with the doctor during the consultation.
Okay.
Additionally, again, as telemedicine has evolved, newer things have become available. So if you are not in your home and you move to, let's say, a telemedicine booth, there are devices that can be used, for example, to examine you. So there are stethoscopes that can be, attached to your body, and the doctor sitting somewhere can hear the same sounds he would hear, if like similar to if you were sitting right in front of him. Okay. And finally, let me say that whilst I appreciate the importance of clinical examination, as somebody who's taught, medicine for almost 2 decades, I'm not at all going to downplay the importance of examination. Okay. However, I also think that sometimes clinical examination is overrated. Right. Because oftentimes when you have even done an examination, you would go the next step to do some investigations to try and confirm, or imaging to confirm what you have felt clinically.
Okay.
So whilst that is important, I think that there are always ways around it.
Okay.
And finally, let me say, for telemedicine to be effective, the provider must be experienced. So if you're going to get telemedicine service, or if you're going to get healthcare online, you should be very sure that the person who is you're consulting with is an experienced person.
Okay.
Because they need to make a decision whether it's okay to continue seeing you online,
right,
or something else.
Okay. Great stuff. 16 minutes past the hour of 2 on Joy 99.7 FM. We're discussing telemedicine, healing from a distance, with Dr. Kenneth Takyi. He's a consultant gastroenterologist, and he's also a consultant offering services by or via telemedicine, right? We're looking at the pros and cons. We're trying to get to understand it. What are the safeguards? And again, I keep sharing bits and pieces of work I've done in the past. I remember and recall, my good friend and buddy, Professor Alex Dodu, and even our Supreme Court Judge, my brother Yoni Kolendi. There was a time when we were looking at making forays into some kind of copy or template of what the UK had called NHS Direct, right? And we're looking at the various scenarios and how we could harness this. There were legal implications, there were clinical implications, and many other things as to this interface, how we harness it. Somewhere along the line, we disintegrated at a point, but some good work was done that laid foundations. So you can click onto something, there's NHS Direct. You may remember the COVID tracker, where they're able to give information about COVID-19 symptoms and many other protocols via the same technology. Now we're looking at a more detailed, should I say, dissection of it. What is happening? How do I know it is truly Dr. Kenneth Takyi, with all his CV and experience, at the other end of the device, right? What are the safeguards, and how is it set up in this country? Yes, we do have quite a number of them running, up and running, doing various things, and offering various end-user benefits, let me call it that. But we need to understand. So, Dr. Takyi, coming back to you, I do know that even though you're not brick and mortar, there's some requirement with regard to HEFRA and other, should I say, regulatory bodies, right, to make sure. Of course, whoever is practicing, if it is medicine, there's the Medical and Dental Council, your licensing, your whatever, and so on and so forth. What are the safeguards? Can you run us through that? Then we'll come back to actual nitty-gritty of telemedicine.
Right. So you asked a question, how do I know who is at the other end?
Right.
And I mentioned earlier on, an effective or a good telemedicine service must be audiovisual.
Okay.
So you certainly must see the person at the other end who is, or you are consulting with, or who is answering your questions.
Okay.
And that would help to confirm that this is the person.
Okay.
But also, data security and privacy are important.
Yeah.
And globally, the standard for telemedicine data security is that the service must be HIPAA compliant.
Right.
And HIPAA means health insurance something.
Yeah.
Yes. So the software that is being used must be HIPAA compliant.
All right.
And so that then means that you cannot, for example, be doing telemedicine using WhatsApp or Zoom or the other, social media platforms.
Right.
Because again, then that means that the person you're consulting with may not have access to your medical records.
Okay.
A good telemedicine service must also allow the clinician to capture data. All right. And this data must be available to the patient and the provider at another time.
Right.
And so if you're consulting with me, I should be able to see your medical records and say, okay, this is what the plan was, just like you get in a normal hospital. But the other benefit of telemedicine is that the patient at another time, seeing another provider elsewhere, can actually access their records and show to this patient or this provider.
Right.
Right. So I think one major concern is the data security. The other thing that is important is that the telemedicine service must allow appointments.
Okay.
So that one of the importance of telemedicine,
proper actual scheduling.
Exactly.
Face-to-face.
Exactly.
Right. Okay.
All right. So it's convenience. So I should be able to go onto the service and schedule an appointment for 6 p.m. on a Sunday.
All right.
Subject to the availability and the convenience of the doctor as well. So if the service does not allow that, again, then it's a bit problematic.
Okay.
All right. So I think these are some of the things, and like I have said, you must always look at the experience and qualifications of the provider.
Okay.
And so these should also be available at the time you are scheduling your appointment.
Okay. Right. And you know, if you're an avid listener and loyal listener of Ultimate Health, we dialogue routinely with the regulators, whether it is Dr. Divine Benyubala of the Medical and Dental Council, the bosses, I think now Dr. Bano at Hefra and Co. We bring them in, and so we will get into some of those other areas at another time. But basically, this is legit. It's endorsed and borne by our legal systems. I do know that what Dr. Takyi runs has endorsement and, should I say, licensing from the data protection regulatory structure in Ghana and so on and so forth. So what we're saying is that your data that you share, the whole process and products of telemedicine must be secure.
Correct.
So you can't go on TikTok and say, I'm Dr. So and so at Wager, and I will enlarge your this part of your body, and I'll do this, and I'm consulting, and then therefore that is telemedicine, right? There are standards.
Yes.
Yeah.
The standards for practice of telemedicine are equal or similar to the standards for practice of medicine in a brick and mortar hospital.
Great stuff. Would this practice also be subject to the scrutiny of the Medical and Dental Council and so on and so forth?
Definitely.
Right.
So that the demand from the Medical and Dental Council is that all your practitioners must be registered and in good standing.
Okay.
And so any telemedicine service provider must ensure that their providers are up to date with their licensing.
Okay.
Otherwise, the same sanctions that would apply to a brick and mortar hospital would apply to a telemedicine service provider.
Great stuff. Ultimate Health on Joy 99.7 FM with me, Norte by Nature. I'm in the studio with Dr. Kenneth Takyi, and we're talking about telemedicine, all right? Sometimes you might hear telehealth, right? Yes. And sometimes you hear e-medicine, right? The same thing, harnessing telecommunications to extend the reach and coverage of clinical, diagnostic and other care, right? You can be diagnosed, you can be assessed by a qualified professional and caregiver, and then the whole process runs all the way to treatment, prescription, and other things, right? The system should afford you the capacity to schedule a convenient appointment with the specialist at your fingertips, so to speak. And we're going to go now through the steps to see, right? But are there any other benefits that I haven't covered before I go into what you do?
Yes. So there are several benefits of telemedicine.
Okay.
To an individual, to a corporate organization, to a health facility, brick and mortar hospital, and even to a nation.
Right.
So obviously the benefit that comes to an individual immediately is convenience, no time wasting.
Okay.
All right. And of course, telemedicine is cost effective because definitely it's cheaper than going into a brick and mortar hospital.
Oh, really? Okay.
Oh, yeah, it's definitely. It definitely gives you data security much more than you would get in a brick and mortar hospital.
Okay.
For an organization like Joy FM, the benefits are that, well, you don't have to deal with too much absenteeism because an individual has to go to hospital.
Okay.
All right. Your reporters in the regions would have access to the same quality of health care like those who are in Accra.
Okay.
For a health facility, obviously, we all know the dwindling numbers of health providers in these recent times because people, brain drain is back and back aggressively.
Right.
However, with telemedicine, you can utilize the few healthcare providers you have to see more patients in different locations.
Okay.
Of course, definitely the overhead cost for bringing in or building your AC and electricity and all those things are also cut.
Okay.
If you're a small facility, it reduces the number of referrals you have to do to a big hospital because then in your hospital you can actually you can't actually be here and be doing ward rounds for somebody in Tamale Teaching Hospital.
Right.
Because they're just moving a trolley around and you can see.
Okay.
Again, it allows, so for a nation, for example, the benefits are that it allows an equitable distribution, even though virtual, of specialists. And so we would no longer have to be complaining that there are fewer specialists in the War Teaching Hospital, because then we can set up such that they can access.
Right, great stuff. Okay. And of course, when it comes to teaching, training and all that,
definitely,
awesome.
That is something that has been going on for years and still ongoing.
All right. WhatsApp is active 055 11 11 997. I see a couple. Somebody wants to know the cost of tickets for the Sip and Paint with Lexus. I think it's 120. Abik will confirm. I think it's 120 at the Villandro. I think tomorrow, May Day, right? The day is typing about breaches. I'll get to that in a second. But let me ask you this question. So I'm qualified. I sit in Ghana.
Right.
I'm licensed, registered, all right? And there's this beautiful tool, telemedicine. Does it preclude me sitting in Accra or Golokwati and practicing in New York? What is there? Is there any spectrum of reach? For example, Joy FM has a frequency and a radius or a range. Can you sit in Kolebu and comfortably be making money and healing people from a distance in, let's say, Liverpool?
Right. So, of course, the regulation or legislation around telemedicine is still evolving.
Okay.
And I know in the US there are various legislations in various states about how telemedicine should be practiced.
Right.
But we must also understand the challenges of trying to regulate such a service. Yeah. Definitely people are already consulting using inappropriate softwares like WhatsApp and Zoom. Currently, we are trying to extend services to Sierra Leone.
Right.
And we have had to submit all our MDS
documents, all your stuff,
exactly, registration to get approval for our providers to be able to see patients there.
Right.
On individual basis, we've had people consulting from the UK, the US, and all over.
Okay.
It's very difficult to restrict because then you don't even know where they are,
Right. So you must meet the requirements of the, should I say, home, region, or country and regulatory
authorities
strictures
if you're going in officially.
Okay.
So,
all right.
Exactly.
Okie dokie. Right. 28 minutes past the hour of 2 on Joy 99.7 FM. We're discussing healing from a distance. Yes. Not the ones that they do and hey, ba, 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 ba. Okay, that's another tell you something.
Another level of healing.
We're not going there. But we're talking about harnessing information technology, right? And harnessing it appropriately to expand the reach of our clinicians, healthcare providers, and I'm speaking with Dr. Kenneth Takyi. He runs one all-round virtual
specialist all-round specialist virtual clinic.
Right. Okay. So it means at your fingertips you have these specialists, should I say, on duty. Right? And they are running a clinic with you. I've got this from Dede in Maryland. Welcome, Dede. Do they have emergency services? And how secured are they with regard to data breach? Okay, I mentioned that earlier. We have the data protection. Is it a council or... No,
yes.
There's an agency, right? And I do see on your pages that all those certifications are clearly displayed there. And I believe they can be validated and verified by users. Okay?
Yes.
Right.
And for the day in the US, definitely she must know about the HIPAA compliance.
Right. Okay. All right. So, yeah, we're doing great stuff. But there are concerns that need to be explained. There's information that needs to go out. So if you have any questions, concerns, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. And shortly, I will activate the phone lines. So we do our own teleconsultation here with Dr. Kenneth Takyi. All right. So what it means is that, okay, no more brick and mortar. The same way I would do a Zoom lecture, you are doing something with more stricture and regulation, right?
Correct.
Checking. Sometimes when you're doing a Zoom and other things, they say recording has proceeded and so forth. You're saying that this data and these exchanges are held securely. right?
Yes.
Okay. So any regulator can go in there and say, okay, we want to check what you've been doing. It can be audited.
Yes.
Right.
So it's just pretty similar to what you get in a normal hospital. So while the interaction is going on, nobody else can have access to the interaction.
Okay.
Because this is end-to-end.
End-to-end. Secure.
However, we capture clinical data.
Right.
And so at the end of the consultation, a regulator can come. And in fact, I think this is even more secured because you can now, once this is saved, it cannot be altered.
Okay.
And so a regulator can come and see your clinical notes.
Okay.
And
All
what
right.
you have done.
Okay. So I see all-round specialist virtual clinic. We are your hospital anywhere, anytime. So there are no working hours?
No.
Seriously?
No.
Potentially? Technically? Operationally?
Anytime.
Right. So let's come to the steps.
Right.
So you've been able to bring together specialists, right, who can offer these services literally, in quote, on air, right? Do they need training to use this tool, to use telemedicine? Can any doctor just be clicking buttons and claiming they are consulting remotely?
Right. So let me say that it's the process for admitting providers as all-round specialists,
right,
is quite strict.
Okay.
And so all the providers are senior specialists.
Okay.
And right now we have over 50 of them on there ready to provide a service.
Okay.
And yes, obviously we need a little bit of, introduction to navigate the system, but this is something very simple that can be done within 5 minutes.
All right.
And for the patients, it's equally very simple. Once you are able to use a smartphone, you just go on, register, and then you are sent a link either via email or text to set a password.
Okay.
And once you set your password, you are ready to go. Anytime you forget your password, you can go there and use the forgotten password button. And you just log on anytime to All Round Specialist Virtual Clinic or asvclinic.com.
Okay.
And log in and, make an appointment, ask a question, because there's also a text consultation bit.
Right.
So you may not, so let's say, and that's again another benefit.
Right.
When you go to your traditional hospital and you leave the hospital, you don't have access to the doctor anymore. However, with telemedicine, let's say you go home after a consultation and you have some side effects or you want to discuss your labs, you can just send this on the system again, secured via text to the doctor. The doctor looks at it and can reply you in real time via text.
Right. Okay, great stuff.
The other very important benefit is that there are many people with chronic diseases, hypertension, diabetes, who are checking their blood sugars and blood pressures and keeping them at home, not knowing what to do with these values. And they will only show it to the doctor maybe in 3 months later and if there was something serious at the time, they would have missed it.
Okay.
Thanks to telemedicine, once you input this either manually or remotely, and it can be done via wireless, your doctor will get an alert if there is an abnormality and then can get back to you to say, look, your blood sugar is too high, let's do this or that.
Okay.
So it's pretty comprehensive.
So essentially by clicking buttons and looking onto a screen and having this exchange with a qualified senior specialist, right? Have I, I was just speaking with Samson as we enter. When I come in, he's also coming in to do the legal program.
Okay.
Have I contracted you? Have I retained you as my a specialist? What is the contractual arrangement? I know we'll get to payment and other things, but as soon as I enlist for this telemedicine, does it make you, Dr. Kenneth Takyi, my gastroenterologist, right? By virtue of click, 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 pay, or Momo, or whatever it is. What is the contract?
Okay, so, and again, this is pretty similar to the contract you get in a traditional hospital.
Okay.
But there's even more to it. So, if you go into the traditional hospitals, many times you are not able to determine or insist on which doctor you see.
Okay.
Because sometimes the doctors vary and,
So in telemedicine, there's a menu?
In telemedicine, you decide. So, you decide that today I want to see Dr. Takyi. The next time you will decide that it's Dr. Takyi because you are the one making the appointment.
Right.
So you choose as you wish. And of course, once the appointment is made and the doctor confirms that is contractual agreement binding, and the doctor would give you all the services just like you get.
So I'll click and I'll see your qualifications, your experience.
Exactly. You will see
your shoe size, everything.
The languages I speak, the qualifications, my medical and dental registration, which you can verify.
Okay.
So it's
legit.
Quite comprehensive.
Okie dokie. I'm seeing some of you are now sitting down. I'm sure you've taken something after church and the WhatsApp is flowing. Let me announce the phone lines. 030 221-6541, 030-221-6541. That is also tele-consulting of a sort. This one, Dede is typing again. Okay, let me read this one. We are nearing May 1st. No, that's a long one, not to me. Please, Joy FM, please ask questions on behalf of those of us on pension. I'm just hoping that it's addressed to us, okay?
Okay.
I'm sure we'll get into other intricacies like whether you accept health insurance and other things. I'll check to that.
Yes.
Good afternoon, Naughty. Great discussion with Dr. Takyi. He's my personal doctor, and I can attest to the fact that he's always there for you 24/7. Where? On air or physically? Please, people should patronize their facility. Sami in Ekropong, Ekwapim. Okay. Sami says that, I don't know whether he's referring to seeing you in Korle Bu or elsewhere or online. But okay, great stuff. Hello, Naughty. I'm loving this telemedicine thing already. Please, may I know the disadvantages associated with this? This is from Fafa in Swedru. I'll dig into that for you. But the phone lines are active as well. If you want, you can also call and ask directly. 030-221-6541. Dede was typing. Okay, here we go. Does one need a referral to see a specialist? Is it possible at a point to set up an appointment to physically visit in facility the specialist depending on one's location? I think you mentioned this, but let's go over that. Yeah.
Okay. So is it possible to set up appointment?
Yeah.
So
to physically,
definitely. So let's see. So all our providers actually also work in physical or brick and mortar hospitals.
Right.
And we have those details. So let's say you see a provider and the provider makes an assessment that they need to see you in a hospital. You can actually make that appointment on the service.
All right.
And so it's called an in-clinic service.
Right.
And that appointment is transferred to whichever facility, physical facility.
Okay.
And so when you go to that facility, the doctor is expecting you, the facility is expecting you.
Right.
Basically, what we are trying to do is to take away the hassle.
So you're building bridges.
Exactly. So you are somewhere you even don't know where to find a gastroenterologist.
Okay.
You go on, find a gastroenterologist. You don't want to see this gastroenterologist online. You want to see him physically.
Okay.
You can make that appointment with the gastroenterologist at his clinic, physical clinic on the service, and then you take it from there.
So let me ask you this. Does it therefore imply, by inference, that in setting up this telemedicine, you must have facilities linked to your service, or can you just be there virtual in the air and you will never see anybody and you're doing your healing, but there are clinics and facilities that say we don't admit to, we don't do this, and can you do it without any linkage to should I say accredited physical facilities?
No, because like I stated, all the providers are not full-time online. Right. They don't only work online.
Okay.
They actually work in physical facilities.
All right.
And so once you are there, and we have, once you are with us, of course, then you become a focal person or a contact to this facility.
Right.
And so if there is a need for you to admit or have surgery in a particular facility, we are able to link that facility through the
needed arrangements.
Exactly.
Okay.
And we have the ability to integrate the physical or brick and mortar facilities actually with our system.
Right.
That's taking a bit of time, but hopefully we would.
So, for example, downstream, Korle Bu might decide that Korle Bu offers telemedicine.
Yes.
Right? Our consultants are available here, right?
Correct.
And so on and so forth.
Yes.
But that partnership, that link must be there, that intersection.
Exactly.
And it must be well understood.
Correct.
Otherwise, I'm sitting in Korle Bu and I squeeze my face and then Abeku comes and says, I booked online, and then he crosses the queue and he goes. There must be a proper interface.
Correct, and that's what we do. So there's scheduling. So let's say if there's no scheduling system in Korle Bu, when you've made an appointment, we would make sure that somebody physically makes the arrangement with the specialist, so that you don't have to go through all the hassle. Okay,
great stuff. 40 minutes already past the hour of 2. Good afternoon, Norte. Please ask the doctor if there's an app that telemedicine or e-medicine can be found on? Secondly, if you are on consultation with your client and the network has a problem, will your data still be there for you, or will it decide? Oh,
I think it's
right.
I think it's an important
technical challenges. Yes. He's asking about that, and then is there an app?
Oh yeah, so there's an all-round health app. So we have 2 apps for the providers.
Let me just explain to my listeners that I'm using Dr. Takyi's telemedicine facility as a proxy prototype to explain this, right? Yes. The intention is not to advertise him or anybody else, but I'm using it because I can now break it down and ask specifics and not just theory, right? So that's what we're doing here, right?
I agree. Okay. So, I mean, most telemedicine services should have an app,
right?
So you can download this app on Google Play Store, or even for your Apple devices,
right? And
a good telemedicine service, remember I said, should be audiovisual.
Okay.
Now, when there are network challenges, very severe ones, the service itself would recognize this and switch it to an audio only. And once the system improves or the network improves, the video interaction is reinstalled.
Right.
Even if everything goes down, no, the data is not lost. It's just paused, and at any time that network is reestablished, you can continue. Or the doctor can book or reschedule the appointment.
Okay. Hence the need to have it on a proper, appropriately secure and set up platform that meets international best standards. That's what we're talking about. Phone line 055, sorry, no, that's WhatsApp. 055 1111 997 is WhatsApp. Phone line 03022165541. Those are the buttons to push to speak to Dr. Kenneth Takyi of All Round Specialist Virtual Clinic. Right, yes. You can find it online, but we're really going through the mechanics, the cogwheels and processes. Okay, so I'm required to register.
Yes.
All right. Even before I say what my name is, what's wrong with me, there's a registration interface.
Yeah.
I complete that, and then I'm interested and curious. Where do I part with money, right? And what are the kind of fees or charges, and how are they? Should I say handled? I've seen a question from Dede. Do you accept international health insurance or just Ghanaian? Right? Do you accept? I think health insurance outside of Ghana health insurance. Yeah.
Okay. So first, let me say that registration is free.
Okay.
So unlike a physical hospital, you don't pay anything for registration.
Okay.
So you just register, and at any time that you decide to use the facility, that's when you make payment.
Okay.
It depends on what service you are using. And it starts from as low as 50 cedis for text consultation.
Okay.
But for the specialist consultation, you are looking, I think it's maximum of 300 Ghana cedis.
Okay.
Yes.
Right.
And that would allow you to have interaction with the doctor for up to 25 minutes.
Okay.
Which is long enough for a doctor to fully assess. We are still in negotiations. The concept is new, not just to individuals, but to health insurance providers in Ghana. So at present, very few health insurance companies are accepting telemedicine as part of their service. But we are in discussions with several of them, and I'm sure many of them will come on soon. But I should add that there are foreign health insurance providers that have actually bought into the idea, and we take care of them.
Great stuff. I have a call on the line. Hello.
Hello, no, it's a good afternoon.
Afternoon. Who's this? Oti?
Oti Wati from Tema.
Oti, you're welcome. How are you doing?
Yeah, thank you. I want to ask Doctor, is it new in the app, or how will you contact it? Is that in the app to download it, to go through, or is it just a number? That's I don't know. Is that an app?
All right. We'll go through that again for you, Oti Boateng.
All right. If I want to do it, because I'm feeling something on my legs, is that an app to register to tell doctor my leg is paining me, so subscribe something for me, and how is the payment?
Okay.
And all is that?
Great, well understood. Thank you, Otin Tema. So okay. So I have a toothache, right?
Yes.
Okay. I get online. I've registered to your telemedicine service. Okay. What happens next?
So you have a toothache. You know that toothache will be seen by a dentist.
Okay.
So you just search for dentists online, and the list of dentists would pop up.
Okay.
And then you read their profiles. Maybe you only speak Twi or Ga.
All right.
And then you can select a dentist who speaks Ga and make an appointment with that dentist.
The system will not select for me.
No. So if you say you are looking for a dentist, all the dentists who are online will pop up.
Okay.
And then you can select.
All right.
You make your choice.
So depending on the intensity of my toothache, I click quickly.
Yes.
The first one I see, Charlie.
Okay, then that's fine.
Sharp. Okay.
However, if you don't know who to contact, there's always a number there and the administrators online. So you can then, and these administrators are also health providers, nurses, pharmacists, doctors. So you speak to any of them that have a toothache.
Okay.
And then they say, okay, then I think you need a dentist.
All right.
In the unlikely event that you also, go and choose, let's say, a dermatologist,
right,
because when it's a toothache.
Right.
When you are booking, it would ask you to give a reason for the appointment.
All
and
right.
so you say toothache. The dermatologist sees it and says, oh no, this should be a dentist.
Okay.
The dermatologist can cancel the appointment and then transfer it to a dentist to see you. And then you get a feedback that it's because, you are better off seeing a dentist.
Okay, great stuff.
Yes. And then let me add that you pay online. So you
pay.
can use Momo or card and pay.
Do you pay before receiving the service or you pay after?
You pay before receiving the service.
Okay.
So once you make an appointment, you have the opportunity to pay anytime or make changes right up to 5 minutes before the appointment.
Okay.
Yes.
So can I register, do all these things, make payment, and Zoom? I'm with a consultant.
Yes.
If the consultant is available.
Yes.
I can.
It's as simple as that.
All right.
5 simple steps.
Okay.
Yes.
All right. I know people ask about refunds. We'll get to that. God bless you, Note. Spelled Note, but it's all good. This will help us persons with disability. Yep. That's a good point, right? Access.
Yes.
All right. Okay. Good stuff. Somebody asked earlier, how different is this from telenursing and all that? It's the same thing.
It's the same, right? Providing clinical services.
Services. All right. So it's the same thing. Is the appointment via apps only, or can you do it online as well?
So it's also, you can do it via the web.
Okay.
Web-based system.
Right. Great stuff. 030-221-6541. Let's hear you. Push the buttons and let's understand this. Okay. So I get to have a consultation. Is there a set limit for the duration of the consultation? How long am I going to be online with this doctor? And then, having answered that, how suitable is this for acute problems or maybe emergencies? Because I'm getting the sense that somebody would think that, well, let me click, and maybe they actually do need to rush to a facility.
Right. So the set time for the consultation is 25 minutes.
25
minutes with the doctor.
Okay.
However, when the 25 minutes elapses, the doctor can, on his own, just extend it.
All right.
It's only the doctor who can end the consultation. So we've had our psychiatrists and our clinical psychologists spend an hour with patients. And so, yes, there are restrictions on the time, but oftentimes patients don't even need the 25 minutes. But when necessary, they can go beyond that.
Right.
And they don't have to pay extra.
Okay.
It was another thing maybe I don't remember.
Yeah, I think once we've got that, I think I asked about the extension and the duration.
Yes.
Right? And then I asked whether you can go straight.
Oh, so for emergencies.
Yeah, emergencies.
So we discourage people from using the telemedicine if they have dire emergencies.
Okay.
So somebody has collapsed at home. If you have access to an ambulance, that's the way to
go to a facility.
Or you have a crashing chest pain. We recommend that you don't use telemedicine because in certain things, the time is of the essence, and so you need to get to a facility. However, if you log on, we're not going to say go. We will give you simple steps and teach you what to do in the interim whilst you're waiting for an ambulance or some things that you can do.
Right.
And if the consultation does not take place, you get a refund.
Okay. Congratulations, Bobu. Dr. Takyi. This is Larry Adoboy. This is the way forward. Better late than never for telemedicine in Ghana. Congratulations again, Dr. Takyi from Bobu. Bishop Herman.
Bishop Herman, and I'm a proud Bobu. Happy to see it.
You see now. Okay. Do they have the price list and everything displayed online?
Yes, we do.
Okie dokie. Yes. Right. 49 minutes past your hour 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living with me, Norte by Nature. I'm speaking to Dr. Kenneth Takyi. He's a gastroenterologist, consultant, head of gastroenterology in Kolebu. You might recall that we did enemas and cocoa with him, but he gets funkier than that. I can an enema consultation or a cocoa consultation would be interesting. So you did mention that you are able to examine a patient.
Yep.
From a distance.
Yes.
How so?
Okay, so like I said, examination begins with inspection or visualizing. So you can visualize, and sometimes you get a lot of information from.
You can actually ask me to use my camera or my phone. Show me this.
Oh no, we are seeing you. So before the consultation,
so let's say I have a swelling.
Great.
Right. So you actually.
So before the consultation, we actually send you on the thing. So it'll be great that you're sitting in a place that is well lit,
good lighting,
good
camera,
something that can allow you some walking.
Okay.
So sometimes we can ask you, okay, walk and let's see.
Right.
Raise your hand and let's see. So that's
okay.
Basic or examination.
All right.
But I also said that there are now things that we can use to examine if you visit a tele booth.
Mm-hmm.
So there are booths that have been set up purposely for telemedicine.
All right.
And then when you go there, there's a stethoscope there, and the doctor
can. You actually direct me to a booth.
Exactly.
Right. Do you have that attached to your service currently?
No.
Okay. Right.
So, but this is something that can easily
be elsewhere we can say book your appointment, your consultation, but we need to conduct it at this location.
So,
right.
So, for example, there is a facility in Sierra Leone that is bringing this up very rapidly, and they intend when we are going to integrate it into our service.
All right.
So there's a nurse there, and you go, they put the stethoscope here, and I sitting in Accra can hear the heart sound. They will connect an ECG to you, and I would see the readings in Accra.
All right.
And so I'm saying examine, and there's ultrasound. But also, in fact, ear examination, eye examination are already well established in telemedicine.
Great stuff.
So you just put an otoscope in the ear, and the picture again would appear in Accra.
So my obstetrician can be literally examining my baby, ultrasound, and all this.
And then
wow, Charlie. No, these days they are mentioning galamsey too often. I was going to say galamsey, but it does extend the services. The numbers of professionals we have in the system is multiplied, right? And I guess there's good justification for it. Started way back. I can trace it. Steps from 2010 it was launched. 2015 it was strengthened. There are laws and regulations. The Ghana Health Service has also done its part, and I believe the Ministry of Education. So it's not as if, we woke up this morning and decided that we're going to promote Dr. Takyi. It's there. There's a framework, and we're looking at how to harness it. If you have any questions, concerns, I've got about 8 minutes left. The phone line direct is 030-221-6541. Talking about telemedicine, healing from a distance with Dr. Kenneth Takyi, right? On Joy 99.7 FM. The program is Ultimate Health. Great stuff. Okay, so what did they say? Something about blood pressure, right?
Blood pressure.
So you should have your BP apparatus by you. The doctor may ask you, check, and so on and so forth. Again, if you have your readings over time, you can share that with the doctor, and he gets it. It's a kind of a profile or a trend.
Exactly.
If it's blood sugar and so on.
In fact, if you upload this regularly, by the time the doctor is coming to consult,
he has your profile.
There's a graph drawn
already. There's a graph and things provided. So there's imaging, there's illustration, and everything. All right. So you mentioned that when I click, I'll see your profile.
Yes.
And the languages, your specialization, and so on and so forth. So are you consulting in Tree, Ever, and stuff like that? Yes.
Thankfully, I speak many Ghanaian languages.
All right.
And so
can I click and say, I want to do this in Ghana?
Oh, no. So you cannot select the language. However, you could say that I would prefer to speak in Ghana.
I'm more fluent or comfortable in Ghana.
That's very possible. So you just, whilst making the appointment, you indicate that. And you would have known that I speak Ghana.
All right.
And so you choose the one that speaks. Exactly.
All right. Okay. Phone line still active. WhatsApp 055 11 11 997. Program Ultimate Health on Joy 99.7 FM. All right. So I can do antenatal online.
Yes.
Whoa.
And the people doing antenatal online.
Whoa.
But the other benefit which the obstetricians put to it is that it allows you to leave hospital early.
Okay.
So rather than staying in let's say you've had a cesarean session or you just delivered, rather than staying in hospital to be monitored, the doctors can send you home.
Okay.
in a day or two, and the rest of the monitoring is online.
All right.
Pregnant women, checking their fetal kicks, whether the baby is moving or not. Yeah. All these can be inputted online, so the doctor is getting a live or real-time notification of what is happening.
Great stuff. So let's say I'm on this and you are managing me. Right. Let's say I have a chronic disorder, BP, diabetes, and so on and so forth. Should my condition change?
Yes.
Negatively.
Okay.
Are you responsible? Because maybe you've seen me, you've advised, you've said do this, do that, do that. I'm seemingly following, and then something changes. Can I hold you, Dr. Takyi, at the end of another couple of millions of wires and a screen responsible?
Well, surely, just like, so the responsibility of a doctor to a patient remains the same.
All right.
And if your condition changes, for example, this is also the beauty about telemedicine.
Right.
Just by the click of a button, we are able to give you a referral to a facility close by.
Okay. And
they would have all your medical records.
Right.
Or whatever has been done for you.
You have the rights and the power to transfer that? Or that? That reminds me, sorry.
Yes.
I had wanted to interface the question of consent.
Right.
During registration and all that, do you give formal consent to the subsequent and anticipated or envisaged procedures and processes? Do you click at any point? You know how online they give you a long page of small print, then it's like accept. You want the thing, then click. What's that like?
So definitely you would have to consent to the whole process. Okay, so that's a requirement. Right. Otherwise, you would not be able to register. So you would consent.
Right.
But so when there's a reason to give you a referral, it's a referral.
Okay.
So, and all these things are given to you.
Okay.
So you can decide that when I go to the hospital, I'll show it to the doctor.
Right.
Or you need a referral to see the next doctor so they know what has been done for you.
Okay.
We print it and then it's available to you on your phone or your laptop. You can print it out. And just like you give a referral to anybody in a hospital to another facility.
Okay.
But the responsibilities remain the same.
What if I have a complaint and it's with you, Dr. Takyi?
Yes.
We've been working online, but now, Charlie, I don't feel you the way I was feeling you, or I don't think things are happening. How is that handled in telemedicine? Who do I complain to? Do I just delete you or switch to another provider? What do I do online?
So that's another beauty of telemedicine. I mean, patient satisfaction scores with telemedicine are very high.
Okay.
In our own experience, after every consultation, you have an opportunity to assess the service and assess the provider.
Like Uber.
Exactly.
All right.
Okay, so, and I should say that as of now, all our clients have rated us above 90%.
Wow.
So the satisfaction is great.
Okay.
In the unlikely event that the clinician is, and again, also the providers also consent to certain guidelines.
Right.
Frequently booked, but not showing up or not showing up on time.
Right.
These will be available to the service, and we can look at this and say, no, we need to take this provider out. Or receiving several complaints of poor or negative feedbacks, we can take you out.
Right.
But if you have a complaint about the whole service, of course, then you have to go to the regulators.
Yes. Okay. Hey, Foden Bato, always with us. Please, doctor, is there... Okay, no, he says there was something about... If I've booked and you refer me, will I pay again? I've lost it. But there was something about booking already and then being referred.
So if the consultation did not take place, let's say it's the one somebody has a headache, a toothache, and they booked a neurologist and the neurologist cancelled it, then that's not. But let's say you see an obstetrician. All right, and during the assessment, the obstetrician realizes that you also have hypertension and sends you to a physician, then that obviously is another consultation, and so you'd pay for that.
All right, great. We'll definitely have to dig more into this. Dede says, what's the name of the app again?
All Round Health App.
All right, All Round Health App.
Yes.
That's the name of the app. Your service is All Round Specialist Virtual Clinic.
Correct.
But when you go to Google or any...
All Round Health App.
All Round Health App. All right. She says, I've uploaded an app, DocPalm. She's not advertising, for easy access when I get to Ghana and need health services. Right. So there are other services. All right. Dede, thanks for sharing that. So great. So we do have this, and you're talking now and counting that... All-round specialist virtual clinic has over 50 specialists.
Correct. And still counting.
So you don't have any medical students, trainees, housemen, whatever.